That is one lecture down. We're going to the next one. We're talking about crown. Put your seatbelts on. Next up. So with a crown, how do you explain what you can't see? Because patients oftentimes don't see the crown. Well, you got to present that the crown actually helps in all three areas, three directions. So the back side, we know about it, the bleacher effect when you look down on the back side, but it can affect the roundness of it, okay? And it can affect the visual density from the front because the hairs up here actually contribute to the front. So it helps everywhere, all right? But the crown is an advanced topic. I don't suggest you to start with crowns for so many reasons, and we're going to go through some of those. And one big reason is who's a candidate. Because if you start operating on 20-year-olds that are, you say, oh, that's a small crown, it can expand. And then you don't have enough grafts to support it and you have this artificial look. So I like to offer you some basic guidelines. Is that it's ideal not to try to do someone too young. And even if you say, well, okay, he's 36, let's do it. But he's got a crown like that big and he's got no donor hair and he's got a whole front gone. Focus on the front before you do the back if possible, okay? I always say that a comb over is bad, but if you can comb back over the crown, there are techniques to camouflage the crown if you don't do the crown. So look at the front as a priority before you get to the back, and make sure everything is at least medically stabilized if there's a lot of miniaturization, and make sure they're compliant with the medicine, but you can't hang your hat on medicine because they may stop the medicine, so you got to be careful with just throwing that out there. And also looking at that really ratio. This is the art and experience that takes time for you to build, which is to say, do they have enough donor today for this bald area, and will they have enough donor in the future? So you got to predict future issues because there's going to be this ongoing depletion of donor, either from decreasing SDA and also decreasing what you have because you've taken it out, and also increased demand because they increase baldness. So look for that. And also understand if the patient truly understands that they need more procedures in the future. A crown, oftentimes, even a single transplant, because of the way it's designed, I cannot... Okay, Douglas, turn up the microphone, please. And that's important. So look at crown hair patterns, all right? It's important to understand what's out there. And the other thing is important is the coronet. You saw some of these lectures yesterday, I think it was Tim. Look for that pattern underneath where that is dipping down because it can be larger than what you think. The billboard effect, I think Biener came up with this idea, which is just the idea is that the crown sits on the vertical plane. So when you look at baldness straight on, it's harder to camouflage than when you look at it tangentially on the horizontal plane. So it's always hard. You think, oh, that's easy. I'm going to nail this in one session. I tell my patients, anytime I deal with a crown, you may need 2 sessions. So I say it for anything, but in particular, I emphasize the crown because it's a world pattern opening up, and you're looking straight at baldness. Because what is the definition of baldness? To me, it's not just the absence of hair; it's seeing scalp. And it's hard to camouflage scalp when it's on a vertical plane. So you got to plan the donor area, and as I alluded to earlier, you got to look for this area, the coronet, where you may not be able to safely do it. And it takes more grafts than you think. It takes more grafts. So if you're dealing with someone initially, you may plan this, but you may think, okay, I may need a larger area, but on an older patient, if you're not worried about as much progression, you could maybe do more conservative. But the younger patient, you may have to be more aggressive because you're worried about that progression going forward. We talked about the female crown just a minute ago, about this Dumble idea. It's just the idea that, I mean, I've done whole female crowns, but this is the idea that a lot of times females just have a little bit of loss in the upper crown rather than the whole thing. So when I look at a crown, I divide it geographically into small areas. The vertex transition zone, I already told you guys yesterday, is a transition from a vertical to a horizontal plane. The upper arc is anywhere above this central whorl, and then the lower arc. And so I want to talk for a moment about transitions. We'll go back to that previous one in a second. So what I'm talking about transitions is that when you start to see this, there are no abrupt transitions. So do you see how there's that the dotted blue line shows you where it doesn't just go boom, boom, it slowly goes, and so your brain needs to think. Everything needs to be a gradual transition when you design, not just this abrupt boom angle change. So if someone is completely bald, do I have a preferred design? The answer is yes, and what is it? Well, usually if they part, most people part this way because they're right-handed. So what I usually like to do is on the upper left whorl, if I can just define a whorl where I would like to put it Personally, my design preference, and you'll talk to 5 other surgeons this afternoon, they're going to say, Sam's crazy, I want it down on the bottom right. It doesn't matter. We all have philosophical reasons, and I'm here to tell you why I like this. It doesn't mean it's good for everyone. I like it because in this area, I can cover the hair part, I can cover the comb direction, and the top portion can fall down over the rest of the scalp, since it's cascading over the vertical scalp. Does that make sense? That bottom, it's hanging down, it's on a vertical portion. So if I further subdivide it using that earlier diagram, I focus the first one on this upper arc that cascades and covers the crown, almost acts like as a comb over, if you will, but that's a bad word. It's covering most of the scalp, so that if you understand that everything distal, down bottom right, is less important, because that upper 1 and 2, one is covering further down, so you're cheating. Because everything when you're doing hair restoration is cheating to get the maximal effect with a minimal number of grafts. And that's what I'm trying to achieve here. And so if you do the opposite, which is less ideal, because that cascade has to now fall back in the wrong direction. This is not ideal, but if they've got a whorl there and it's pretty defined, you don't want to cut through and destroy all the hairs and create your own little pattern. So if they're pretty much gone except for a few ghost hairs, I design what I want to design. I design that usually, but of course there are exceptions. And then you just got to really look, what if they have a whorl here? How do you prioritize it? Again, the priorities are based on that cascade effect of how to leverage and cover it. And these are all in the book of just how to design things. And then if you look at allocation, not just the density gradients, but the size of those follicular units, like 2 hair grafts, 3 hair grafts, there's occasionally 4 hair grafts, not everyone has them. This is how I design it. Okay, and so it's maximizing leverage of density gradients and follicular unit grafts. And again, all this stuff is esoteric. You're not going to get all this, what I'm saying. It's too much information for you. Why do I even bother to present it to you? Because it tells you how complex what we do is, and it gives you the beginning of appreciation. You're not going to get all this understanding immediately. So I just use needles here, and this is just showing you a counterclockwise right-sided whorl pattern. There's a clockwise left-sided whorl pattern. And for me, you can hear other speakers talk about liking the crown low. I like to make high crown sights. In other words, very high like this. Why? Because I think in nature, actually, the angles are quite high back if you look here. Remember I told you very low in the front. And again, no abrupt transitions. If you start looking at scalps, you see this. The angles go from low, high, back to low. That offers actually a lot of advantages. Here it is. If it's in a whorl, all right, and you make low angles, they're all competing for the same space underneath if they're all going in different directions. Does that make sense? But if they're vertical, there's less subcutaneous competition of sites. Plus, they go up and back down. So it's tighter. You can fit a tighter pattern, and creates that lift, that loss of that side roundness that I talked about. So I like those sites to be higher in the back. I like the sites in the front to be lower, and that's and the advantages, again, round profile, added density, and tighter placement. This is just showing a model of what I'm talking about for angles. Again, just the more redundancy and the more ways you see something is better. So just a quick case study here, designing the greater density in this central area. Why? Because I can use the cascade, because the whorl for him starts over on the other side, and then I just create other grafts that are of great importance, secondary great importance, which is the vertex transition zone, and what's in orange is not as important. Still important, you can't just create this abrupt density change, but this is just a general way of thinking. It's just a general way of thinking. This is not meant for you to memorize all of this. It's just to tell you there is a creative thinking of everything you do. These are just grafts being placed. And this is just showing you one of those many design patterns I showed you the other day. This is just showing you some sites that I've created and what it looks like my design, okay? So so this just different whorls are out there, and this is showing the from that last pattern. So hairline mid-scalps, if the patient is supine, you can much more easily create low sites. If they're sitting, it's much easier to create patterns in the upper portion, and then to make the lower portion, I turn them this way, okay? Obviously, I'm not wearing a suit, usually during a surgery, but it's just for demonstration purposes. So I usually now, today, do mega sessions where I do the whole thing from front to back with the priority toward the front. But for you guys, just to understand, you're probably not going to be doing something like that. That's really not safe to anywhere in your first five years of practice or more. So these are just different clockwise whirl. The side pattern you can see is improved with there's a roundness there. There's a gentleman with a slot deformity with one transplant, at least to cover the slot meaning he had a scalp reduction, where that's an old school thing that you may not even see anymore today. But you need to know how to correct that if you see it, because you may not do a scalp reduction, but you may have to fix one. I just fixed one last week actually. So these are old procedures that a lot of people don't do anymore. This is just unusual shapes there, diffuse patterns of loss in a female, finer grafts in an Asian. They still look good that you can get this in this area. You can do just the upper arc, and so if it's just the upper arc, you can create more visual density because it's just going up versus splaying open. These are corrections of plugs, okay? And this is done with FUE. And PRP A-cell can work very well too sometimes in the crown area. So think artistically. You're not going to understand every little esoteric point of this lecture, the point in general with all these things, because I'm giving you 3 successive advanced topics for a basic course. Why? Because you need to know about it. It doesn't mean you need to go out first day and do a female transplant. In fact, I think don't do it.